Hello, my name is Professor Colm Cunningham, and I'm the director of HammondCare's Dementia Centre. It's my privilege to introduce you to this Stronger Together webinar, where we will talk to Topaz and HammondCare about the partnership, and I will be joining the panel in a few minutes. But I'd firstly like to acknowledge the Currle people, the traditional custodians of the land on which I'm presenting today, and pay my respects to their elders, past and present. I extend that respect to Aboriginal and Torres Strait Islander peoples joining us today. A very special welcome to Frank van Beuningen, our Consul General of the Netherlands here in Sydney, who's here with us today to celebrate our new partnership with the Dementia Centre at HammondCare and Topaz as an aged care provider in the Netherlands. This partnership is going to extend a relationship that's gone over many years as we continue to grow and learn and challenge each other in a number of areas. They include the design of the built environment, the cottage model here in Australia and growing in the Netherlands, through to our understanding of palliative care for people with dementia, and a particular specialism that Topaz bring to our partnership of their expertise in understanding the needs of people with Huntington's disease. There are many things that we are both going to learn about our successes and experiences and things that we can shape from the stuff-ups that we occasionally make. So it's so important to have this cross-cultural collaboration between the Netherlands and Australia. And I'd like to now introduce Frank to tell us a little bit more about his experience in 2018 of knowing one of the people joining our webinar, Professor Wilco Achterberg. So it'd be great to hear from you, Frank, about your experience of working with him and what you think is important about this partnership.
Thank you very much, Professor Cunningham, for this introduction. My name is Frank van Beuningen, and as I always say in Australia, just call me Frank. That is the easy part of my name. Welcome to you all, in particular to the members of the panel. I hope you don't mind me extending a very warm welcome to Professor Wilco Achterberg, with whom indeed I've been in touch before, and who gave a fascinating presentation a few years ago over here in Sydney. Dear participants, dear friends, I was asked to speak a little bit about Australia and the Netherlands as partners. Well, we are partners, definitely. Maybe as you Australians would say, we are mates. And we go a long way back. The Dutchies were even the first Europeans that explored Australia. But also in the current days, we are partners. When I look from the economic perspective, I do not only the Consul General over here in Sydney, but I do lead the economic team of the embassy and the Consulate General for our activities Australia-wide. If I go a little bit back in the history of the bilateral relationship between Australia and the Netherlands, it may be good to mention that there was this huge immigration, huge for our country, maybe not so much for the influx into Australia in the 50s and 60s of people from the Netherlands to Australia. And I think they blended in very well, even so much that the number of people of Dutch heritage is much bigger than the number of people who still speak Dutch here in Australia. But it is exactly that group of people that is aging now. And for that reason, I think it is very topical, very relevant that this type of cooperation between the Netherlands and Australia is being established. As a kind of a personal impression, I'm not an expert, not at all, I'm a diplomat. I might mention that I have observed that when people get older, they tend to fall back on their on the language that they learned as a child, and in particular, there you can see that the communities of people can help these elder people to feel to still feel at home, feel comfortable, although of course they are reaching an age and an age that we, or I should say our families like 30, 40 years ago wouldn't dream about of reaching. People over 60, I'm one of them, I need to confess, still run, are very active, do sports, etc., etc., and their retirement is still years away. And that active lifestyle is, I think, something new of people who get older these days. But then we are also much more healthy than people were in the past. When you think about the health sector, I think you can say that the Australian health sector can be considered world class, although it is under pressure. As a post-industrialized nation, the health sector, or I should say Australia, is facing an aging population, increasing chronic conditions, and a growing demand for new treatment options. And in order to keep the healthcare on the excellent level that it is now, innovation is really necessary, not only in Australia, but also in the Netherlands. And for that reason, I think this type of cooperation between our two countries is really very helpful and very relevant. And I really like the title of this cooperation, Stronger Together, because I think that tiny country over there in Europe and that big continent over here, when we work together, I think we can achieve very good results, but also results that are really relevant for the aging population in both our countries. If I may, I would like to close off by mentioning one of the innovations that comes from the Netherlands and is now being introduced over here in Australia. That is a company that has introduced the so-called tovertafel, the magic table, where people with dementia can play on a table where from the ceiling certain figures are projected on the table, and it keeps these people fit and happy to be able to do that. I may have been speaking too long, sorry for that, but I do wish you a wonderful, lasting and productive cooperation. And of course, I also wish you a very good webinar. Thank you very much for your attention.
Thank you so much for being able to be with us today, and wish us well on this partnership. I'm going to throw now to Marie Alford, who's the head of the Dementia Centre Services, who's going to chair the panel, and I'll go and take my seat on that panel as we consider the issues of the partnership and many of the things that we're going to be talking about in future webinars, including models of care, and we will, of course, talk about the current pandemic. Over to you, Marie.
Thank you, Frank von Berningen, the Dutch Consul General and Associate Professor Colm Cunningham, the Director of the Dementia Centre, HammondCare, for that great launch to this session. I'm Marie Alford, the Head of Dementia Centre Services here at HammondCare, and I'd like to welcome you today to the launch of this international partnership. I'm joined today by thought leaders from Australia and the Netherlands who have a shared passion and commitment for aged and dementia care. Topaz is an innovative aged care provider in the Netherlands. They specialise in dementia care, rehabilitation and Huntington's disease. Here at HammondCare, we focus on providing care for people with complex age, dementia and healthcare needs, as well as specialised research and dementia advisory and support services. So welcome everyone. I'll introduce you as we go along. Firstly, Talia de Jongh. Can you tell us a little bit more about Topaz and the work that you do in the Netherlands?
Yes, thank you. My name is Lia de Jongh. I'm the CEO of Topaz, and we provide institutional care and daycare for about 1,000 residents, many of whom suffer from dementia. And we also offer consultation and care at home. And we are very active in research in dementia, rehabilitation, and Huntington's disease.
Fantastic. Thanks, Leah. We're also joined by Professor Wilco Achterberg, a professor of institutional care and elderly care medicine. Wilco, can you tell us about your role at Topaz and Leiden University?
Thank you, Mary. Very nice to be here. I'm an elderly care physician and a researcher, and I'm employed both by Topaz and by the Leiden University Medical Center. And my role is to improve nursing home care by facilitating research that serves the residents and the caregivers. Topaz and several other nursing homes in our region as a living lab model, work as a living lab model. So in a way, we create a kind of academic nursing homes. And also I help developing our dementia expertise center that Topaz has created together with another organization in our region, Activit. Also in order to use research to make better use of knowledge in the care for people with dementia.
Fantastic. Great to have you joining us, Wilco. And from here in Australia, from the Dementia Centre at HammondCare, we have Associate Professor Colm Cunningham, and we're also joined by Professor Sue Kurrle from the University of Sydney, a geriatrician and a carer for her mother living with dementia. Firstly, Colm, can you tell us a little bit about HammondCare and the Dementia Centre?
Well, HammondCare was established in the 1930s to meet the needs of people here in Sydney. And over the years, it evolved into an organisation that met the needs of older people. And nowadays, it's known for its specialism in complex dementia and palliative care. In 1995, it opened its first dementia-specifically designed cottage, one of the things it's known for. And alongside that, looked to Scotland and its dementia centre and established its own dementia centre here in Australia. And that centre was established firstly to inform and drive the currency and evidence base of our knowledge, and more recently to advise other organisations here in Australia and internationally. And those areas include our specialism in understanding complex behaviour, especially behavioural and psychological symptoms of dementia, and the palliative care needs of people with dementia, the design of the environment, and how we engage with people and have relationships that are based on those transactions of empowering people with dementia in the care they receive.
Thanks, Colm. And finally, to Sue. You've got a long history with both HammondCare and Topaz, but I'd love to hear first a little bit about your background and then about your connection with both of those organisations.
Thanks, Marie. I have been involved with HammondCare at a few different levels. Firstly, I was a member of the HammondCare board from 1998 till 2014. And I watched it grow and develop. It was just amazing. Secondly, from a research point of view, I was involved as the lead investigator for our Cognitive Decline Partnership Centre, and HammondCare was the biggest partner. We did a lot of really good research together around guidelines, around exercise for people with dementia, around the best model of care for people with dementia, the cottage model of care, and all the benefits that. And thirdly, as you mentioned, my 94-year-old mother who has dementia has been in HammondCare facilities for the past 5 years. She's been in several facilities because she was expelled from the first one. She went over the fence 3 times. And so she went out to Hammondville where they kept her very busy. And then she's moved back recently to be closer to me. But I have really experienced the care that Colm was talking about, that we talk about, that HammondCare does so well.
Fantastic. And I think we'll touch a bit more on that experience with your mother a little bit later. But both for Sue and Wilco, talk us a little bit talk us through how this partnership initiative started.
I'll start, Wilco, because I went on sabbatical to Leiden, to the University of Leiden in 2010. And I've been going back each year till COVID hit last year to teach, but particularly to learn. And it was on one of those visits in about 2012, I think it was, that I met Wilco and learnt what he did and the unbelievably good idea of elderly care physicians with training in multiple areas. He also introduced me to Topaz, and I guess I recognised immediately the similarities with HammondCare, the philosophy of looking after people other people didn't want to look after, the really difficult ones, their different approach to care, the innovation, the coming out of left field, the let's try this idea, and just their fresh way of, I guess, of looking at things. And I could see areas that we could really learn from as well. And so I kind of joined them up, I think you'd say, Wilco, in that we developed the relationship. Wilco and Leah came and visited Australia and spent time here. And now we're actually formalising that relationship. We've been engaged for a long time. Now we're getting married.
Yeah, that's great. It's about 10 years ago when we met, and within a few minutes we understood each other. We talked about the same issues, and it seemed like we had the same thoughts and the same framework, what is important for people with dementia. And you don't meet people who are based in both research in university and in care process and have this thought, and you were always driven by the needs of people with dementia and not by your academic achievements. And so really, although it's very the distance is very long, the distance in philosophy was very short. So we kept contact. We did some work together. We about medical decision making. And we did some other research together, and then of course I had my sabbatical in Australia, and so we went and saw all the HammondCare facilities, and we went to the University of New South Wales, saw some hospitals, and we really were even more astonished than by the developments HammondCare has on and the vision on dementia care. So we said, Leah and I said, well, we should do more with that. We should exchange knowledge because we think that we can learn from HammondCare, and we also think that HammondCare can learn from us. So we are very excited for this engagement or this marriage.
I'm very happy to be officiating at the marriage today. So welcome everyone. And now I'd like to talk with Leah a little bit more about your motto at Topaz. So the entire life counts. What does it mean? And can you give us an example of what that means in practice?
Yes, of course. Your entire life counts approach is characterized by a very personal focus. One of the programs that we have been working on for the last few years is called From Regulation to Relations. We try very hard to focus on the relationship-based care. Before we look at the rules and the regulations, we look at the effect on the quality of life. Residents all want to be seen as a person and not as a patient. They don't come to be nursed, they come to live with us. So what are the personal needs of the people that live in our homes? And what we experience is in our way of caregiving is that reciprocity is very important. Residents can mean something for their formal caregivers because it's a two-way process. All parties involved benefit from a good relationship. And within Topaz, we always talk about the importance of the care triangle, the resident, the family, and the caregiver himself.
I really think that statement around regulations to relationships resonates for us here in Australia. So I know that our Australian listeners will be very interested to learn more about what that means in the Netherlands over the coming months. Colm, picking up on that last statement of Leah, can you talk a little bit more about the model of care here at HammondCare and how our cottage design model fits into all of that?
Well, I think Leah underpinned it by talking, it's all about reciprocity. It's all about the relationships. I often say that in 1995, when HammondCare opened the Meadows, one of its first cottage facilities, it was a heart-led decision. It was looking at what is driving the challenges that people with dementia are facing and how do we compensate for that? How do we ensure that they can see and sense in small, domestic, familiar environments? It's interesting that Sue's work in the Cognitive Decline Partnership Centre and their important research has demonstrated that through that small domestic model, and I'm talking about people in groups of maybe 8 to 10 people or 12 people living in a group, that we make decisions easier and we ensure that the care model is around what that person needs. So for example, it isn't always led by a nurse. You have the same amount of hours of a nurse, but we have empowered care workers who are leading those relationships with families and friends. But also we are empowering the person and taking extraneous issues out of the way. So for example, the doors to the gardens are not locked. The deliveries of food or laundry are in back of house corridors that do not distract people because they are unnecessary. While of course having those things, a kitchen that's working and real and where we're cooking together and where laundry can be done, but making sure that's managed in a way that empowers the person and that we are not worried about the balance of care in the facility. So we match people and the cottage they live in using a particular tool to ensure that the complexity of their needs matches the cottage they live in. So for example, we have specialist dementia care units that allow for people with really complex and intractable behaviors to live in smaller environments, but not with people who might be more physically frail and at risk of harm through that. So matching people's needs through the progression of the condition and the organic needs that they may have, particularly when you talk about care like Huntington's disease, which we're going to be talking about. So that's such an important thing. And I guess in terms of the evidence, I always say that in 1995, we led by what we thought was right. Sue's work has shown lower admissions to hospital, lower use of medication, and a lot better outcomes for people in those small domestic models. And interestingly, there's a question now in the time that we find ourselves in is whether they're also helpful in a COVID era.
Thanks, Colm. We know that the environment has such a big impact on the experience and quality of life for people living with dementia. We've talked a little bit about the dementia cottage model here at HammondCare. At Topaz, it's called small-scale homes. Leah, how is the Netherlands approach design in environments for older people?
When quality of life is your ambition, you need to be a bit radical to achieve it. So we try to make room for new ideas. So we have changed the layout of our homes so we achieve a more family-style home. In our newly developed homes, a daily host functions a bit like an in-house mother. She cooks in the open-plan kitchen. She creates a good atmosphere during dinner, plays board games, or gives a helping hand to the nurses. And we have specific thoughts about atmosphere and light and an enriched environment that creates no negative triggers. Also, our co-workers flourish in a work environment where they can make their own decisions, and we really think that the attrition rate in a small-scale living is better than in the regular nursing homes. So that's our way of trying to make the design fit for good care.
So I'm wondering, how do you think environment and the model of care influences your mother's experience in an aged care home?
I think the cottage model of care, as Colm and Leah have described it, is probably as close to home as possible. And Leah said it, we're not there to provide nursing, we're there to provide a home. But for my mum, when she first moved, when her dementia wasn't as severe, she was helping with preparing meals. She was peeling potatoes, chopping up pumpkin. She was hanging out washing. She was bringing it in. She was folding it. She was arranging flowers. She was doing all the things she used to love doing at home. And her needs have increased, but she still sits there in the middle of the home and everything happens around her and she can still take it in and be part of it. And the other thing is the staff. Leah mentioned the low turnover. Many of the staff that look after Mum now were there when she moved there nearly 3 years ago. And honestly, I think they know her better than I do. And it is just amazing. And I love when I go in, and I'm still allowed to go in because of our wonderful Partners in Care program that we're going to talk about, the smell of lunch. cooking is really terrific. It is so much like home. When she turned 94 a couple of weeks ago, birthday cakes, celebrations, they took photos. It was just wonderful. It's so like home. They don't have a cat or a dog, but I'm sure we'll get there one day. And I think that idea of being a real almost home, not quite, but almost home, is just so wonderful.
And can I add to that there's some very interesting facts that are coming out in this conversation, because we too find that even in our more complex facilities with people with significant behaviors, the attritional rate is lower, and that's consistent with what our Dutch colleagues are telling us. So there's something here about empowering the staff in an environment that they can work effectively that is reducing that attrition rate. And that is significant because for Sue, it means that relationship is not only with seeing her mum, it's with people she trusts. And trust is so central to what we're all talking about.
Moving on to something that's on the minds of us all right now, the current pandemic. Wilco, can you tell us a bit more about your research project, Isolate, which is about the impact of COVID on people living with dementia?
Yeah, thank you. Well, we interviewed both formal and informal caregivers for persons with dementia. And we did this with Mandy Visser, who we worked at the University of Technology in Sydney, but came to Leiden University Medical Center and Topaz. So she's a little bit, she knows the best of both worlds. But she interviewed those caregivers in the community and in the nursing homes, and in the COVID period, of course. And we found that especially persons with mild to moderate dementia in the institution suffered and showed more agitation in this period. For more advanced dementia, this was not so clear, and often they also seemed more comfortable in a situation with less people and less commotion, less hassles around them. So that's also something we can learn about, that having all kinds of visitors is not for everybody so good. We looked at the nurses. The nurses often felt very guilty because they could be with the resident and the family couldn't. Family was really happy with alternative communication methods, such as video calling. But we also found that people with dementia often did not understand why their son was on television, and that made them anxious or restless. So we learned a lot on what kind of things are important. And you should probably be very careful when using these kind of methods for people with especially more advanced dementia. So we learned a lot, also for the post-COVID period.
Colm, Sue touched on HammondCare's Partnering in Care project here at HammondCare. Can you talk us through what that program is about and the impact it's had on isolation in the care homes here at HammondCare in Australia?
Well, I think the first thing to say is that like our Dutch colleagues, we found it very distressing, the isolation that potentially people were facing. But we also touched on earlier in Leah's comment about the fact that you must go, what do you want the outcome to be? And then what does the regulation say? We've got a bit of a regular quote here about know the regulation better than the regulators, because often we are driven by what we think the regulation says. And in that way, we went, hang about, we don't want families to be separated, but we can't have everybody coming in. What if we looked at the volunteer model, where we are still allowed to let volunteers, and as long as they have done the necessary training and hand washing and all of the important things that we know are so critical during a time like this, and we said, let's do that. Let's accredit these family members as volunteers specifically for their family member. And we called that Partnering in Care. And even Sue, I'm sure, will tell you that even though she's a respected doctor and somebody I quote regularly, she did the lot, including the hand washing, to ensure that she could be with her mum. And I think it's been so important because others have talked about the isolation, particularly even things around meal times. We know that natural assistance of just being there when somebody's got their food in front of them to assist and ensure that they're not losing weight and that, never mind all the loneliness that's been touched on. So partnering care came about because we questioned what's the right thing to do. And don't get me wrong, it's meant we've had to put resources in to ensure that there are people there to check people in and out and all of those things. But the value has to be ultimately about how we care for the people we serve in a time of significant isolation.
Sue, you talked a bit about the notion of isolation, and Leah, Wilco and Colm all talked about loneliness in aged care. We know this is not something that just happens during a pandemic. We know that people in aged care can feel anxious and lonely because there is a lack of stimulation of visitors and engagement. Talk us through some of the work in the intergenerational space that you've been involved in.
Yeah, so the concept of intergenerational care, so bringing older people and young people, you know, babies, children, infants, children together is not new. And the benefits from it are known, but it's how you do it so that both groups benefit. And we've certainly done work both in residential care, where we brought children into an aged care facility and we watched the depression scales change completely. Their quality of life went from 2 to 10. Their mobility improved so that they were running egg and spoon races with their walking frames. It was quite amazing to see the benefits that came when we took children into residential care. But because most people, certainly in Australia and the same in the Netherlands, most older people live in the community. So the second, I guess, series that we looked at was having a preschool and bringing older people into the preschool, older people who were living alone, who were lonely, who were isolated. And again, we saw the difference. We saw it in frailty, we measured that. We saw it in depression, which we measured, quality of life, and you could eyeball it. You could see it because it was on TV, the incredible improvement. And it wasn't just for the time of the program, it has continued. And despite COVID, those older people are still getting out because they've suddenly discovered they can do it again. They've got their confidence back, their joie de vivre, whatever that is in Dutch. And I think it's so important. And COVID has completely stopped us doing it in some situations. But I feel we will get there, and certainly even using virtual programs is helping a little. But I think the future, once we're post-COVID, once everyone's vaccinated, is just amazing as we join children and grandparents, if you like, together again. It's just so important.
Thanks, Sue. And I hear that in future, they'll be looking at teenagers in aged care settings, which brings me to the Netherlands and the story of a young man who is now living in a care home. Leah, do you want to share a bit more about that fantastic story with our Australian colleagues?
Yes, he's called Topaz, and he's a young student, and he lives in a nursing home. And the essential for me is that what he does is treating the elderly like normal people. So he drinks beer with them, and he visits the zoo, and what he does is just all the regular things we do as well. And that's what we also say, that the reciprocity, being seen as a normal and not as a patient, it's so important. What we also try at Topaz is we invite students, because Leiden is a university city, we encourage students to become volunteers in our homes. And we have also a lot of people with dementia with a very high education. And for them, it's very nice to talk to young people and sharing their knowledge. It's still there, you just have to find it. And we also, like Susan told us, the children from kindergartens, we invite them at the holidays, at Christmas, Pasen, I don't know what's the word in English. So we can enjoy the holidays together. And we see a very good result of that. It's so important to just play a normal part in the daily lives. So I think we should encourage that very much.
I think we'll see a lot more conversation happening in this partnership around the intergenerational aspects of care, but also looking at isolation and the impact of current pandemics. So whilst we're hoping that we'll move through this with fully vaccinated populations, we know there are other things that impact care on a daily basis. So I look forward to that being a point of conversation and learning. But one of the other things that came up for both of our organisations in those early discussions was our shared knowledge in two particular areas that interested both our workforce, but also the broader sector. So for Topaz, in Australia here, we're really interested in learning more about the work that you do in the field of Huntington's and the care environments in which it's delivered. So Leah, would you like to talk us through a bit of that work?
Yes. Topaz care for patients with Huntington's disease now for over more than 30 years. And in these years, we have been building up a lot of expertise. We care for those people. The care for those people is very complex because they are often younger than the regular patients and residents, and they have a combination of physical, emotional, social, and psychiatric needs. So we work together with neurologists, psychiatrists, and we are able to take really good care of them. And at the moment, we are the largest long-term care Huntington Center in the world. And we have about 80 beds and over 100 ambulatory patients. And we also develop cooperation with the Dutch and the European patients organizations. And we are an important European knowledge hub.
Thank you, Leah. Colm, HammondCare has led the Australian government-funded Dementia Support Australia program for quite a few years now. It's delivered services to over 50,000 people since 2017. What are some of the key learnings from that program?
Well, I think one of the first things is the beauty of what the Australian government has done is join the program up. So it's a national program, which is quite unusual from countries across the world. There's many examples of great programs in different states and cities. But what we're able to do is actually bring together an incredible amount of data that's telling us what people's needs are at different stages. So we support people in the community, in residential care quite significantly, and when people are ready to transition out of hospitals. We're not trying to fix the hospital system, that's a big challenge. And to ensure that people are getting the right support in a timely manner. So for example, where people have significant and severe behaviours, we have to be out there anywhere in Australia in around 48 hours, which if you know our country is quite a significant thing to do, but we actually do it most of the time. And we're working in 40 locations out across Australia, including in our Northern Territories and with our Indigenous communities, our First Nation people in Australia. Some of the things that come out will not surprise you because I've been part of these conversations, which is know the person first and foremost. Often we will go in and we are dealing with the fact that there is a barrier between the staff and the person because they don't understand who they are and what drives them. And so the first thing is often the expertise in calming everything down. So knowing the person is a significant thing. But there are many other things that we find are key issues, like they need to assess and manage pain well, often a very significant trigger in the morning and can lead to a day of success and stress for everyone. And of course, the built environment. But the attitude and skills and knowledge of care are also key, of the care staff are key. And we have a team of clinicians across the country who help us also review the pharmacological issues that are going on, because obviously people are often in a situation of polypharmacy or restricted practices being used that are inappropriate. What has changed since the program started is that we're now looking much more at the areas of delineation in the program. So how do we support more people at home? How do we support people in prisons? How do we support the police? All of those things are becoming more to the fore as we've started to understand the data better. And significantly, that separation between responsive behaviors that are actually about some of the situations we've just described, and the organic progression of the condition, and the right environments for those people who may be a smaller group of people but need a lot more support. And if we don't support them well, we end up actually using our resources poorly, because they unfortunately will be bounced around the system, and they suffer, their families suffer, and the health system suffer. So a new addition to that program is thinking around specialist dementia care programs. There's lots more I could say about it, but dementia.com.au, you can find out a lot more about Dementia Support Australia.
Sue, the Australian government has introduced the Specialist Dementia Care Program here in Australia. Talk us through what led to the development of this program and what we are hoping to see changes in the aged care sector as a result of this.
As a clinician who visits residential care to look at people with the really severe behaviours and psychological symptoms of dementia, I am very thankful that the government is looking at developing these specialist dementia care units, which are basically units of 8 to 10 beds set in an established residential care facility. So they sit as part of it, and they're for those people that can't be managed anywhere else, what we call the heart sink patients, because we're rung about them often. They're the ones that you try medication, you try all the different non-pharmacological and pharmacological management methods, and it doesn't work. But we know, and our experience with the couple that we've had over the years, I'll do almost anything to get one of my more difficult people in, because I know it might take 6 months, it might take 8 months, might take 10 months, but on the whole, those behaviours can be managed, and that person can then go back to a more normal way of living, and families just feel so much better. We should have 35 of them across Australia. We've got 10 at the current time. But as a clinician, I am just so grateful we've got them now, and I would love to see them develop further. We are waiting for those other 25.
Thanks, Sue. One of the topics which Topaz and HammondCare will be working on together is professional development. Leah and Wilco, can you talk about the education system in the Netherlands and what is so important about what you do?
Yes, for example, our nurses, they have, when they start, a 4-year education before they have their diplomas. And that it's not only the level of nursing, it's also for the caregivers, the helpers. We think that having a good education and knowing what it means to have dementia is essential to be a good caregiver. Otherwise, you get so much complication because they don't understand why people are behaving the way they are behaving. So we think it's so important to have a good education for all your staff.
Yeah, and I think that's also an opportunity for our cooperation, that we can, because we need very tailored training programs for all people around people with dementia. And so if we can exchange these training programs, we also can help each other.
It seems we have a lot to talk about in the future around some of those intractable issues that we're facing in care and what our responses might be. So I'm really looking forward to more discussion about complex dementia care, Huntington's disease, and our professional development programs in the future.
But a final question to wrap up the session today is around palliative care. So some people think that palliative care is only available or should only be available in a hospice or hospital setting. So Wilco and Leah, do you want to talk us through some of the ways in the Netherlands that you're approaching palliative care?
Well, in the Netherlands, most people die at home, but for people with dementia, it's more complicated. And fortunately, almost no person with dementia die in the hospital. So most die in our nursing homes. And we have a lot to improve, but I think we provide good medical, nursing and spiritual care for them. And we spend a lot of energy in training in education.
And I think it's a really good example of an area that we are going to really benefit from the learnings from each other. For us, with the start of that Dementia Support Australia program, we discovered that people with severe behaviours who we were getting out there too quickly actually died within the next month. There was a significant proportion of people who actually had terminal agitation or terminal delirium. And so the bringing together of expertise in palliative care and dementia care is going to be so crucial to support people at home, because unfortunately our numbers are going to be even lower. And I'm sure Sue's going to, I'm sure, chip in on the fact that we do not support enough people at home in general when they're palliative, but even less so when people have dementia.
Yeah, I remember my first patient when I went to Topaz. She entered the nursing home on Monday, and when on Friday she died. And she was hectic. She was very poor state, had all kinds of wounds and problems, and so the family couldn't adjust in this few days. So it was very. It was not the care that you wanted, but it was not possible to stay at home. And of course, the hospital is also not a good environment. So there's a missing link here.
Well, there's another link as well, Wilco, which is in the Netherlands, you have recognised the need for specialist nursing home physicians, because I hear too often here in Australia of people who have the expertise when these issues are happening, and they spend a lot of time having to negotiate with people who don't have the great specialism that you do. And I think, again, that's another opportunity that I'm excited about in the partnership, about how we can talk about those direct benefits. Because why would you want a nurse to have to spend an hour negotiating with a GP when they know that this person has terminal needs that may not be typical to what they're expecting to see somebody lying down in a bed, but these people have the expertise. This person walking around is going to perhaps pass away in the next few days, and that really does surprise a lot of generalists. So again, the Dutch, I think, have a lot to teach us here.
Recently, we wrapped up our Royal Commission into aged care here in Australia. There was a recommendation around dementia and palliative care training into aged care. Sue, what are your thoughts on this, and how is it going to inform our workforce here in Australia?
The importance to me, to come back to what Colm said about the elderly care physician model in the Netherlands, it's the one thing I want to see before I die, is that we get that model into Australia. The model of physicians trained in geriatric medicine, rehab medicine, because let's face it, we can get a lot of these people better. Palliative care, we've said it's so important, and aged care psychiatry. It is that important for specialties. We're trying very hard that we employ a palliative care physician and an aged care psychiatrist in our team in aged care, and we are already aged care and rehab, but we're 4 people. We need to be 1. And Colm, I will really push that, because that model, Wilco, we need to bring to Australia. It fits with everything. I want to be cared for in my last years by an elderly care physician, not by a GP who only sees 3 old people a year. There is so much we could learn from that I think is really important.
I think this partnership is all about learning, and I think it's also about the humility that we all want to bring to this, because we will make mistakes. One of the things that I've never been able to learn how to teach is passion. But one of the great things about this partnership is we have it in bucket loads. So that's one of the things that really excites me about the strength of us together. So I am so excited by that.
Thank you all for joining us today to learn more about this exciting partnership. I am pleased to welcome Matthew Newhouse, Australian Ambassador to the Netherlands, and Wilco, Leah and Els from Topaz to conclude this session.
Welcome in the final part of our webinar, Stronger Together. We want to have a look back right now at what we've discussed today, because after the opening performed by the Dutch Consul and the HammondCare CEO, we had a lively panel discussion with scientists from both institutions. And of course, collaboration between our 2 countries is very much the subject of today's meeting. And in that aspect, we are very honored that both the Dutch Embassy and the Australian Embassy collaborate in our webinar. So I'd like to give a warm welcome to Matthew Newhouse, the Australian ambassador based in The Hague in the Netherlands. Thank you for joining us, Mr. Newhouse.
Thank you, Els. Great to be with you.
Yes, thank you. And also at our virtual conference table are Leah de Jongh, the CEO at Topaz, and Professor Wilco Achterberg, a professor of institutional care at Topaz and at Leiden University Medical Center. So thanks for joining us again, Leah, and welcome, and Wilco.
Thank you, Els.
My name is Els Oosthoek. I'm the CHRO at Topaz, and I will host this conversation. So clearly, the first question is for you, Mr. Newhouse. Collaboration, I guess, is very much at the heart of your work. Can you tell us a bit more on the collaboration in general between Australia and the Netherlands?
Well, thank you very much, Els, and great to be here, of course. Collaboration between Australia and the Netherlands is very close and at the highest level. I remember well 2 years ago, fortunately before COVID hit, traveling with Prime Minister Mark Rutte to Sydney and to Melbourne, two largest cities, and having discussions with our own Prime Minister, Mr. Morrison, but also having a very active program with business, which Mr. Van Renigen and the Dutch Consulate General in Sydney and also the Embassy in Canberra and Consulate in Melbourne were very, very involved in. It was an excellent program, and it demonstrated the diversity of our economic and political engagement, which has only grown despite COVID. The Netherlands is a major investor in Australia, I think now probably the largest in Europe, given that the UK has left the European Union. And also we are just building our trading links at all times. And we've just recently, just in the last few weeks, opened an Austrian office in Amsterdam. So it's the collaboration is very wide-ranging.
Yes. Oh, so the office in Amsterdam, that's quite new for us. So congratulations on that aspect. So in general, what would you say stands out regarding this collaboration between Australia and Dutch organizations? Are there some like general rules of thumb?
It's an interesting question, but the thing I would say most, and it's probably relevant to the discussion we're about to have as well, is our shared values. And our shared values, even though we're at opposite ends of the world, what bring us together. And we find that when we're working together in the international organizations, here where I represent Australia at the OPCW and the International Criminal Court and the International Court of Justice, we see that in the stance we take on development programs, on security issues, in addressing human rights issues, together, arms control, and so many other areas. But it's also our commitment to free trade and a democratic world where everybody's human rights are respected.
Yes, okay. So shared values, that's a good thing to build upon, I guess. So what I was curious about is in what way you are familiar with dementia care in Australia. We have understood that you are familiar with HammondCare. Can you tell us a bit more?
Yes, well, I'm familiar more broadly with dementia care and also specifically with HammondCare. Dementia is an issue that touches everybody. My own mother worked in this area. My stepfather, sadly, in his later years, suffered from dementia and had to be cared for in one of our aged care homes in Australia where they were living. And so we know it's quite a high quality in Australia, and I know that from personal experience. Oh. With regard to HammondCare itself, of course, the whole HammondCare has developed over many years. My family, my grandparents knew Archdeacon Hammond, who established HammondCare as it was, and it wasn't called HammondCare then, but it's still in memory of his name. He was a Calvinist Anglican clergyman from Sydney who was very concerned during the Depression with families who had lost, parents had lost their jobs, the children were destitute, they had no homes. And he started by building small houses in what is called Hammondville. And I remember as a child myself in the 60s visiting Hammondville. But he died in the 40s. But even before he died, he was starting to realize as the world came out of the Depression that there was a real need in aged care. And so in more recent years, of course, HammondCare developed out of these origins, and aged care has become a big focus of their work. And along with that, necessarily a focus on dementia as well.
Okay, well, thank you so much for exploring this. I've really heard some new things that I didn't know yet about HammondCare, so thank you so much. I'd like to move over to Lee and Wilco. I'm sorry, we know each other very well, so I call them by their first name. So Lee and Wilco, we had a slight inkling now on what you expect from this collaboration. And on the previous panel discussion that you both also attended, of course, we discussed the impact of COVID on people living with dementia. And of course, we discussed the challenges both our organizations have at this point in time. If you look back at this panel discussion, Lee and Jongh, what do you perceive as the biggest themes that will come across in this Topaz HammondCare collaboration?
For me, the very important outcome will be that we are learning from each other, and we can solve problems together in a better way than we do it apart. And like the ambassador already said, the shared values that we share are very important. And whether it's going about research, whether it's going about learning, dementia, and Huntington's disease, having knowledge is very good, but sharing knowledge is much more important. So I'm looking really forward to that.
Yes, oh, thank you so much. And Wilco Achterberg, as a scientist, your field of work is perhaps by nature already more internationally oriented than would be regular care institutions. So how do you perceive this collaboration from an innovation point of view? And what are you most looking forward to in this collaboration?
Yes, thank you. We have kept our eye on the developments in Australia for many years, the research, and for instance, we have a very interesting innovation and intervention for people with dementia and their informal caregivers called More at Home with Dementia. And we actually started in this week, in the Dementia Week, in Leiden. And it has been developed in 1997 in Australia in HammondCare. And so we have a lot of shared values. Also in research, you have shared values. You looked at the personal life and the quality of life, people with dementia. And so we are far apart, but our values are very close to each other. So we can learn very much from our innovations, and I think the exchange of knowledge, and I've personally acknowledged that when I was in Australia, you can grow from exchanging knowledge. So I think both organizations will have a huge challenge in the next future, and this cooperation can drive good quality innovations for the persons with dementia and people with Huntington's disease.
Yes, thank you. So actually what we are looking at is really the importance of collaborative learning together. And to sum up, as a last question for the three of you, what do you all think defines success as an outcome in collaborations like these? Or what are you most looking forward to? Mr. Newhouse, could I give it to you the first chance to reflect on this?
Well, first of all, success for me is better quality of life for those who are suffering with dementia, and sharing knowledge so that we can do the best. Who knows, any one of us may indeed be in that position one day. So it's very much self-interest. And in that regard, I would like to highlight it 2 years ago when we had a very important Royal Commission into aged care, which has since reported. Two of the commissioners did come here to the Netherlands to explore some of the innovations you were doing, to explore the dementia village concept, which I think has been really pioneered here. And even I, when I was with Prime Minister Rutte, we were visiting one event, it's called a gaming event in Melbourne. One of the things we did see together was this table that's been referred to, where older people have a lot of fun playing with it. And we had quite a lot of fun too with it. But it was really, I've never seen anything like it, but it was, I learned something from that. Even though I don't think Prime Minister Rutte had seen that before as well. But it just showed the innovation that was happening and where we could share knowledge for the benefit of all our older citizens.
Yes, wonderful, wonderful. So I think you refer to the Tovertafel on that aspect.
The Tovertafel,
yes, wonderful. Thank you so much. Wilco. Oh, we don't hear you.
Sorry, I think that two things will drive the success for this cooperation. And one is curiosity, and the other thing is enthusiasm. And I think that we need both things to enjoy our work and to be successful in our drive to improve the lives of people with dementia.
Yeah. Okay. Well, let's hope that we can use both to get stronger together. Leah, I'd like to end with you. So, could you reflect on the success of what this will bring for you?
Yes. So I'm excited about the acceleration in knowledge and the acceleration what it can mean for the quality of life for the elderly. There's not only people with dementia, but also in designing houses for people with dementia, and especially sharing our knowledge of the Huntington's disease with our colleagues in Australia, because also like dementia, Huntington's disease is a very severe disease and it needs special treatment. And I think we can help each other a lot for improving care. And that's, for me, I'm looking forward for that.
Okay, thank you so much. So, well, I'd like to end all by thanking you all for being here on this virtual conference table. So thanks again.
Thank you very much.
Thank you for joining us to hear about this partnership. We are looking forward to sharing more of the expertise of each of our organisations with you and growing the capacity and skills of both the Australian and Dutch aged care workforce through the outputs from this initiative. Thank you.